Has the demographic for the population that you see in your clinic shifted at all? I know with other conditions, we see maybe slightly younger patients getting it and things like that. Have there been any significant shifts, if it, at all, that you've noticed?
Um, I still feel like I'm seeing kind of a similar demographic. I do think there's a lot more like awareness. So probably we are getting people diagnosed at an earlier age who are more aware of the condition and more interested in really like kind of digging deeper and figuring out what's going on. But I still have a number of patients, who come later in life and who at that point are like, you know what, I was thinking about it and I've been dealing with this for 40 years. And I asked my clinician, can you maybe run some blood work on me? Or can you just send me to a rheumatologist? Or some come themselves, they self-refer and they say, I just want to know. And so I do feel like we get that referral or question a lot more in clinic
Mhm.
recently.
And do you have any final, maybe go-to teaching points for colleagues or even for patients that are just beginning their Sjogren's journey?
So I would say for colleagues, I think having a low suspicion for it, always having it in the back of your mind. And maybe there's an idea that sometimes I hear from patients or even colleagues that they feel like, well, we're very busy. Our clinics are very busy. We have long wait times. And I think there's an idea, well, I don't really want to refer there because they've got a long wait time and there's so many things already dealing with. And I don't think this might be something as important that needs to get in. But from our standpoint, we would rather see the patient and get them in and address their concerns and be able to intervene sooner than later. So, although we are busy and we have long wait times, and that's kind of the nature of rheumatology, we are more than happy to see them. So, I wouldn't be, afraid to send the referral or get them in. We're happy to see those patients. And really thinking about autoimmune disease is so important. And then from a patient standpoint, I would say whenever I see my patients and I diagnose them with a condition, I'll tell them, well, I kind of give it, it's very overwhelming. So often I'll tell them, this is what I see going on. And a lot of times it's okay to take time to process it, learn about it, and a lot of times I'll kind of give some, education, handouts, and give them time to think about it, really process it, and then kind of come back and talk about how we're going to manage it long term and things like that. While I think there's really great information out there, you also have to remember that your story is your own story, and autoimmune disease is extremely variable person to person. So listening to people, talking to people is super important, but you have to remember that your own manifestations and story will be entirely your own and not the exact same as somebody else.
Wonderful. Well, this has been an amazing conversation, Dr. Tareen. Thank you so much for joining us on MD Newsline podcast.
Sure. Thank you for having me.